Hello, everybody. This is Dr. Richard Marchetti, DC, or Doctor of Chiropractic from CBP Precision Spine Center. And today I'm trying something new. It's called the CBP Teaching Series. And what I'm going to do is focus on explaining topics in more detail. Now, these topics can be broken down into multiple little videos that will go on Instagram and Facebook and Twitter and things like that. But ultimately, at the end of the day, this long form content will be on YouTube. And so today we're going to go over understanding disc pain problems. Now, the majority of patients that walk in my clinic have some form of back pain or neck pain, and a lot of them come to me from hospitals or other clinics, and they've been told they have a disc issue. So we're going to go over these in detail, and if you enjoy this content, like, share, follow, and subscribe, and hopefully we'll make more things that you'd be interested in. So going forward here, why do disc problems cause so much back pain? Well, disc injuries are, again, as I said, one of the more common things that walks in my office here. And up to about 80% of adults will experience some form of back pain at some point in their life. The problem being that it's not always discal pain. You know, again, I'm being told that, oh, my doctor told me I have a disc problem, and I don't disagree that you do, but it doesn't necessarily mean that it is the disc causing the pain. So when we go through our examination, we run through a lot of different, what they call orthopedic testing, which allows us to determine whether it is actually the site of the pain, if it's the disc, or if it's a joint, or if it's a muscle, or if it's a fixation of the joint, so on and so forth. Again, the problem is that many disc injuries are misunderstood. You know, we see these MRIs that come in with very mild compressions, and they're being told it's the disc causing the pain. In fact, it's not. And then also when it comes to treatment, now the focus of this particular talk is not going to be about the treatment options. We will discuss them briefly, but we're not going to go into any detail, and I will do that in a later video. But treatment often usually focuses on symptom reduction and not truly the underlying cause of how this problem came about in the first place if you have a disc. So what is an intervertebral disc? Well, on the right side of the screen, you can see this video, and you'll have the bone, and in between each bone is what we call the disc. It's a tissue in between the bones. Now, it's the spinal disc, as it says on the slide here, is a fibrocartilaginous cushion located between each vertebra. So there's a fibrous content, cartilage content to this, which we'll get in more detail. And it acts as a cushion between the two bones. And as it says, they act as shock absorbers. They allow motion, or they facilitate motion between the joints. They help us distribute our weight between the joints. And they also act as spinal stabilizers. Now, there are 23 discs in the human spine. So when you tell me that you have a disc, it always helps to know which level those discs are at. I'll ask, and again, I get random numbers from time to time. So what do the discs actually do? Well, we said they help facilitate movement. So they help you when you bend forward or when you bend backwards, even when you bend side to side. They can help you with rotation as well. And they absorb compressive forces within our spine. So think about when we're sitting or when we're standing, when we're jumping, when we're walking, these discs are allowing our spine to move on the inside. So during daily activity, they act like little hydraulic cushions that redistribute the forces throughout our spine. And of course, healthy discs maintain proper spinal height and nerve spaces. So again, you'll have people who tell you, I got shorter as I got older. Well, it also means they probably lost fluid within their discs. So let's go over some of the anatomy. As we showed you earlier, we have a bone, and between each bone is a disc. Now, the thing that exits between the two bones is our spinal nerves. So if we get closure on those nerves, we're also going to get pain and discomfort and functional problems and even long-term health problems. So within our discs, we have two levels. We have the outside part of the disc known as the annulus fibrosus. And on the inside, we have something called the nucleus pulposus. So you'll see here the annulus fibrosus has a tough outer ring. It's made of layered collagen fibers. And then the propulsus is a gel-like inner core. It contains water and something called proteoglycans. Pro meaning protein, glyc meaning fat, right? Glycerol, protein, right? Together, they create a pressurized system to help distribute forces. So let's talk about the annulus. So as we said, it's the outside part of the disc, and they call the annulus fibrosis, the outer ring. It consists of 15 to 25 concentric, which means going around, right? Talk about concentric circles, round and round and round. Layers of collagen fibers. Now, these fibers are arranged in alternating directions. So if you look at the photo, we have one line going one way, and we go to the next layer, it goes the opposite way. So that makes a really tight format between the discs. So it makes it, as it says, arranged in alternating directions, but extremely strong under tension. And it also helps provide stability to that disc. Now, the inside, as the pulsus, the inner core, it's made up of mainly about 70 to 90% water. So this is when we talk about a disc becoming dehydrated meaning loss of water. Okay, and then we have proteoglycans, if we already mentioned that, protein and glycerol, and then of course collagen structure, right? So collagen being another protein-like structure in our body that gives the disc and the ligaments and the tendons a structure that makes it very tough. The functions, it helps maintain the disc pressure, right? We lose that pressure inside. We start to lose the height of the disc, and we start to lose that hydraulic factor of the disc. It helps distribute the compressive forces. So I always explain it to patients like it's a balloon, a water balloon. If we squeeze it from one side, the water goes to the other side. And then it allows the spine to adapt to movement. Now, how do we injure our discs? Now, again, people think they have an injury because of an accident. And that could be the case, right? Trauma or sudden load. But a lot of times it's due to bad posture or sitting for long periods of time. So we have degeneration over time. Again, discs do not have a direct blood supply, so they actually do not have a direct fluid supply. They're getting their fluid through movement. So this is why movement is life, is what some people will say. So as we bend and we're moving, we're pushing and we're, as it says, a hydraulic action. We're pulling fluid into that disc. Repetitive bending can be, again, bending itself can be beneficial, but repetitively over and over again, it's just like anything else, you're going to wear out over time. All right, so these forces can cause tears in that outside structure, that annulus, allowing for the nucleus, that inside material, to move outward. And so when it comes to different types of discs, this is a big part of why I want to make this presentation, because so many people come and say, hey, I have a disc in my spine. And I'm like, yeah, we all have discs in our spine. In fact, by the time you're 65, it's something like 86% of people will be able to show some sort of disc degeneration or discal bulge, as we're seeing here, on an MRI. So does that mean that 86% of 65-year-olds are walking around with some sort of disc-induced pain? And the answer to that question, obviously, is no. All right? So disc bulge or disc degeneration is what the spine is showing here, what this image is showing. We have the outside disc, and it starts to push outward towards what we say the nerve and the spinal cord. All right. Now, the disc extends beyond the vertebral body limit. The annulus remains intact, though, and that's a really important thing. That this material here remains intact. It tends to be symmetrical, which means that it can bulge out on both sides, although you can see it asymmetrical as shown in this photo here. And typically, as it says here, it may not cause symptoms. And I would say that's probably pretty accurate. If we're not getting any significant pinching on the disc, we don't think it will probably show any signs of specific symptoms. However, as it says, also it can progress to a more severe injury. So if it's like this, it means something is loading it incorrectly, and it's starting to get weaker and weaker, and it may go to the next phase. Type 2 is called a protrusion, or otherwise on a report you may see it written as a prolapse. And I put both names in here because, again, you might read protrusion or you might read prolapse. And so a protrusion occurs when the nucleus pushes against a weakened annulus, and the outer fibers begin to stretch, right? So we get a localized bulging sensation. But again, that annulus stays intact. So now we're getting the opportunity to really compress on that nerve tissue as it comes out. The third type is going to be a extrusion. So the extrusion or herniation. Say I have a herniated disc or I have an extruded disc on a report. And that would be when that nucleus breaks through that outside annulus and the material starts to spill out. Now, these are when most people come into me sideways, right? They're in a lot of pain holding their back. They can't bend, they can't move, they can't sleep. They're in a lot of pain. And they've now gone to the medical doctor or gone to the hospital and had an MRI. And the problem here is once you get to this level, the chemicals that have spilled out, as it says in the consequences here, are inflammatory. We get significant compression sometimes and usually severe pain. Now, here's an interesting thing, though. Does this mean this person needs to have immediate surgery? And the answer to that is absolutely not. Okay? This is a condition that with enough time would actually go away on its own. Meaning, if that material has not reached level 4, which we'll go into in a second, then over time the body will slowly get rid of that material, that extruded material in the canal. It'll dry up. Cellular activation, like macrophages, will come and eat it up, and it will eventually go away. The problem is that we don't give it enough time. And of course, people don't want to be in pain for that long. So this is where therapy really comes in handy, because we can get in there with things like laser, deep heat, other modalities, if you will, to start to stimulate the healing process to be much faster. And so I know a lot of people here may have heard about decompression, which we could talk about in another video, and I'll mention it briefly here. And those are great for the first two, the protrusion and the bulges. But when somebody extruded like this, we definitely don't want to be doing decompression right away. Again, I always akin this to the same as a scab. Like you rip your skin, you're bleeding, and it scabs over. So if this area finally scabs over in here, the last thing you want to do is go pull the scab, because it'll start leaking again. So that's what, to me, decompression or really aggressive therapy can be like. You just re-tear the scab and re-irritate the area. So once we allow the healing, we slowly let those concentric fibers come back together, heal up a bit, obviously do some light manipulation of the joint to keep the movement there, keep muscle work to reduce muscle spasm, and you can even start doing some mild exercises to strengthen the area. The last thing you want to do is go and pull and rip that disc again. So the last type is sequestration. It's the most severe form of that protrusion, or that extrusion, or that herniated disc. Because what ends up happening is some of that material that has come out actually breaks off and hangs out in the neural canal here. It really causes irritation to the nerve. Sometimes, again, with enough time, as long as you weren't getting severe neurological symptoms, weakening of your muscles, or atrophy of your muscles, severe numbness or tingling, or conditions like what they call cauda equina, which is when the nerves are basically impinged that you start to lose control of your bowel and your bladder functions, then this is a condition in which you can kind of go over time, and the body would eat away some of that material as well. But if you're getting any of the above mentioned just a minute ago, where we're getting that severe numbness, where we can't start to feel our feet, or we're starting to lose control of our bowel and bladder, or if we're atrophying in our muscles, or losing or getting what they call foot drop, the foot's not able to be controlled, then perhaps this is the time that you would need a surgical intervention to remove the offending material. Okay, and again, we can talk about different types of surgeries in another slide.